Thursday.
Today is Germsday Thursday. Today's germ topic is on that of the bacterium Bordetella Pertussis, also known just as pertussis. And also, why do we need a vaccine? Welcome to my YouTube channel. Welcome to my nursing channel. My name is Nurse Master Charlie. If you are a returning visitor, then welcome back and a big thank you for your support. If you are new here, then welcome. I'm glad you are here. Hopefully we can become virtual friends and or virtual colleagues. On my channel, I talk about and share about nursing school related topics and tips, as well as health related topics, tips and information. So like I mentioned, today's germ topic is on that of the bacterium Bordetella Pertussis, also known as pertussis. So what is pertussis? Pertussis is a highly contagious respiratory disease that is caused by the bacterium Bordetella pertussis. Have you ever wondered why you received a vaccine for pertussis, more likely as a child, or even what pertussis is? Actually, you probably never even gave it a second thought. Now, in regards to vaccines, whether it was for yourself or for your child, you have probably heard of pertussis, but in the form of an abbreviation and in combination with other vaccines known as the DTaP or Tdap, which is short for pertussis, diphtheria, and tetanus. These are a combination of vaccines against these particular infectious diseases. In this video, I'm going to share about the pertussis part of these three: diphtheria, pertussis, and tetanus. Please see my other video for diphtheria. I'll put a link in the card here. And I will share about and describe about tetanus in my next Germsday Thursday video. So be sure to find me every Thursday or every other Thursday for a new Germsday Thursday video. So did you know you probably have heard of pertussis before, but by its more common other name. It is also known as whooping cough. Historically, pertussis has been around for quite a while, but was first really noticed in the Middle Ages. The Bordetella pertussis bacteria was only recently isolated about 110 years ago, and a vaccine was invented in 1914. The vaccine was eventually combined with the diphtheria and tetanus vaccines in the 1940s. These days, due to the waning effect of the vaccine, a booster may be needed for some people. So what happens in pertussis, and how does pertussis occur? As I mentioned earlier, pertussis is a bacteria called Bordetella pertussis. This is what it looks like. This bacteria is very similar to the diphtheria bacteria, but these bacteria attach to the cilia of the upper respiratory system, like within the lungs. What are cilia, you ask, and why does that matter? These are cilia. Think of them like tiny hairs that line the inside of the respiratory tract or lungs that help move mucus and other foreign particles out of the lungs. The pertussis bacteria release poisonous toxins that damage the cilia, causing them to become immobilized and ineffective, as well as causing inflammation to occur, resulting in the swelling of the airways. And what goes through the airways? Well, that would be air or oxygen. What are signs and symptoms of pertussis? The symptoms of pertussis generally begin about 5 to 10 days after someone has become infected. These symptoms include a low-grade fever, rhinitis or runny nose, and a mild cough. The cough begins slowly but then develops into its signature whooping cough. This whooping or whooping cough occurs after a coughing attack that is rapid and violent in appearance. It occurs in rapid, repeated bouts until all the air is expelled from the lungs. As a struggle to inhale oxygen, a person makes a strong and loud whooping sound in an attempt to bring in air or oxygen. In adults, pertussis usually begins looking like a cold or flu, and in infants and babies, pertussis does not always present as it does with adults. It can be the same cold or flu-like symptoms, but with the addition of apnea, which are temporary pauses in breathing. Unfortunately, some babies do not have a cough or a whoop, so it is not known that they have pertussis, but pertussis causes them to stop breathing and turn blue. Most infants less than 1 year of age usually require hospitalization due to how pertussis affects their breathing, and pertussis is still a significant cause of death in this age group. To make things worse, symptoms of pertussis sometimes do not develop for as long as 2 to 3 weeks, and in which 2 weeks after the coughing begins, people are most contagious. There are 3 general phases of pertussis. Stage 1, the catarrhal phase. This is the most infectious phase, and it's when symptoms of runny nose, fever, sneezing, and mild cough occur. Stage 2, the paroxysmal phase. In this phase, coughing becomes more intense. The whooping sound can begin. Vomiting from continuous coughing may occur also. Stage 3, the convalescent phase. In the last phase, most symptoms have stopped. The patient is in a slow recovery phase with a chronic cough, which may continue for weeks. How is pertussis diagnosed? Pertussis is diagnosed by performing a health history, assessing signs and symptoms, obtaining a mucus sample from in and through the nose, and assessing recent exposure to pertussis. How common is pertussis? An increase in pertussis cases occur every couple of years, and outbreaks also do continue to occur. According to the CDC, in the United States, in as recent as 2012, there were almost 50,000 new cases. In 2018, there were more than 151,000 cases of pertussis worldwide. How is pertussis contracted or transmitted? Pertussis is transmitted from person to person and is a disease that is only found in humans. Pertussis is transmitted via aerosolized respiratory droplets like many other diseases from coughing or sneezing, and then it is inhaled. What is a treatment for pertussis? Treatment consists of the diphtheria, tetanus toxoids, and acellular pertussis DTaP vaccine for prevention, and early antibiotic therapy for treatment and to minimize the spread and shorten the amount of time someone is contagious. Even with the vaccine, a person can still contract pertussis. However, the infection is generally more mild. This can help prevent people of all ages, especially babies, from getting really sick. Unfortunately, for those who do contract pertussis, after 3 weeks of having pertussis, treatment will have little benefit as the bacteria have already wreaked havoc in your respiratory tract, damaging many cilia, leading up to a slow recovery phase, which can be for months, and who wants that? So although pertussis can occur, outbreaks could be more frequent and with more cases of people becoming infected and more sick, coupled with other existing diseases such as pneumonia, COPD, and asthma. Can you imagine? Let's not. And the reason things are not as they could be, meaning worse, and the reason it rarely occurs is because we are vaccinated against it. So remember that when you hear about DPT or Tdap, that's Tdap with the P being pertussis, you now know what it means and what it is and what it can do. For all you nursing students or nurses, if you were to encounter a patient with pertussis, how would you care for them? From a nursing perspective, in the assessment phase, you will be assessing, and most importantly, as a top priority, it will be maintaining a patent airway. In addition, nurses are going to assess and monitor the patient's vital signs, their temperature, pulse, blood pressure, but it will be more focused on assessing the patient's respiratory status, including their work of breathing, their rate, depth, quality, pattern, use of accessory muscles, retractions, nasal flaring, and oxygen saturation, as well as auscultating for abnormal lung sounds. Some nursing interventions may include administering antipyretics, oxygen, and antibiotics as ordered, and to encourage fluids and nutrition to promote healing. So if you found value in this video and learned a little something, please be sure to give this video a like as it helps out my channel. And don't forget to share this video with anybody who may benefit from this information. Those wanting to learn about vaccines like the pertussis vaccine, those with children, those that you know who are in nursing school, starting nursing school, or are pre-nursing, or just anybody wanting to learn. If you are interested in information and nursing related topics like this, I'd like to invite you to subscribe and be part of my nursing channel, and also hit the notification bell so you can be made aware of when I release new videos. I'm going to be doing a series of videos about most of the vaccines that are needed for children from birth to 18 years of age, and also those for adults including pertussis, diphtheria, tetanus, measles, mumps, rubella, polio, pneumonia, shingles, rabies, and smallpox. Please be sure to check out my other nursing topic related videos, my nursing related music lyric videos, and my YouTube shorts in which I created Germsday Thursday and Medication Mondays, in which I highlight and share general information about certain medications. And also Sweet Saturdays, in which I share and compare the amount of sugar in certain food products. So be sure to check those out and learn some quick tidbits of bonus information. And if you don't know what I was talking about when I mentioned my nursing songs or my lyric videos, which are actually here on YouTube, but I also write and create nursing and health related educational music like the flu shot song and what is diabetes and the nursing process song, to name a few. You can listen to my music on almost all music streaming platforms such as Spotify, iTunes, Apple Music, Pandora, etc. Also be sure to check out my nursing blog on my website, www.nursemastercharlie.com. I'll leave a link in the description. So be sure to find me every Thursday to every other Thursday for a Germsday Thursday video. So until the next video, God bless and goodbye, and watch out for pertussis or that whoop whoop whooping cough.
Germsday Thursday. It's Germsday Thursday.
It's Germsday Thursday.
Germsday Thursday, y'all. It's Germsday Thursday. Time to learn a little bit about different germs. Time to learn about that bacteria and those viruses. Don't forget the fungus among us.